Management of pediatric primary varicose vein. Motivation for this study is the limited number of studies handling this subject. As we know, there is no correlation between the size of the vein and its complication. We had fatal bleeding reticular varicose vein. What about the sources of reflux? It may be axial, crossover reflux, coronaphlebectasia, posterior tibial perforator, anterior arch vein, or combined. It is like a net with complications. From the embryological point of view, as we know, in early intrauterine life, the veins were the source of blood supply to the organs, so the function as arteries. And later on, after the formation of the valves, it will be veins for returning of the blood. From the genetic point of view, as we know, if both parents were positive with varicose vein, we have about 90% of the offspring having also varicose veins. This some publications to demonstrate that fatal hemorrhage from primary varicose veins. The aim of study is to see the methods of management and the outcome in this pediatric age group. Our armamentarium: conservative therapy, injection, thermal ablation, surgery. We had 50 children and our cut-off age was 18 years. For exclusion criteria, we excluded secondary varicose vein and congenital vascular malformation. Duplex study: if we had suspicious, we do CT venography, and as you can see, here is the vein in superficial and here is the vein from superficial veins, but there is no arteriovenous communication. For injection sclerotherapy, we used AccuVein for visualization. This syringe with sterilized air by gamma rays, and it takes scleral half or 1% in foam. To enhance visualization by using AccuVein, some of our surgical instruments by stab avulsion, different hooks, use of laser and tumescent anesthesia. For our results, between male and female, a little part, about 50% and 50% male and female. For the risk factor, as we see here, family history was positive in about 74%. According to CAP classification, reticular veins were the most common, followed by leg edema, What about the complaints and indication, and why we had worked in this age group? It is a social indication. For the female cosmetic problem, the age of marriage in Egypt is 18 years, and they consider this is a cosmetic problem and must be treated before marriage. For the male, before admission to military faculties, they must treat varicose vein. And we can say this is for social or anything like this, which is special in our society. Maybe other societies, but this is our situation in our country. We had two patients presented with bleeding varicose vein in pediatric age group. What about the function, distribution, and the site? Most of the cases were diffuse reticular vein, followed by cases along the course of great saphenous vein. Least cases were below from the small saphenous vein. In pediatric age group, there were no axial reflux in more than half of the cases, followed by perforator reflux. Only 20% combined ostial and perforator. What about the type of intervention? Half of the cases injection sclerotherapy, followed by cases of stab avulsion. The least number of the cases, only one case, laser ablation, 2%. Improvement of venous clinical severity score. Here is the difference in venous clinical severity score improvement for each type of intervention. Demonstration of some cases. Here is injection sclerotherapy and improvement after treatment. Here is surgical intervention, pre and post. Also surgical intervention, injection sclerotherapy for reticular vein before admission to military academy. We can see this patient and the diameter of the vein. So there were no indication for laser in a vein more than 2 centimeters in diameter. We performed surgery and here is the result. This is 14 years old child with bleeding from lateral malleus, combined surgery and foam sclerotherapy, and here is the result. This to demonstrate a case of fetal hemorrhage, injection of gadolinium post-mortem, and trying to find the microfistula, but they failed to find it. In the previous case for combined surgery and sclerotherapy, we have many advantages, such as 2 goals in one session, sterilization, pressure bandage, or medical stocking for shorter time, patient preference, no pain, no needle phobia, and resuscitation facilities are in operating room. To summarize, varicose vein in pediatric are rare. Pediatrics patients may be presented by dilated great saphenous vein as adult patient. However, ostial reflux is less common than adult patient. Injection sclerotherapy is safe in this age group, and it was the most used intervention in this study. Foam sclerotherapy during surgery as a treatment of acute bleeding varicose vein was used on 2 patients in the study. Stop avulsion and perforator ligation is safe and effective in pediatric age group with perforator reflux, which is the most common in pediatric age group. Thank you very much for your attention, and I would be between you, but maybe next time. Thank you very much for your listening.